So why don't we dive right in? It's 3 minutes after. We'll start with introductions. Welcome everyone to the Program and Grants Committee. We haven't met for a while, so I'm going to start with Pat.
Good afternoon, everyone, and those listening in. My name is Pat Kimball, and I'm the chair of the Maine Recovery Council. Welcome.
Great. Todd.
Hey, good afternoon, everyone. My name is Todd Brackett. I'm the sheriff in Lincoln County.
Great. And Amber.
Hey everyone, my name is Amber Pulsfar. I am an individual with lived experience. I am also a clinician that works in MAT in Aroostook County.
Great. Chastity.
Hi everyone, Chastity Toole. I use she, her pronouns, and I'm the executive director for the Maine Recovery Council.
Great. Elizabeth.
Hi, I am Elizabeth Fortier, and I am the coordinator for the Maine Recovery Council.
Great. Grayson.
Hi, my name is Grayson Havens, and I'm with the Attorney General's office.
And Liz, if you're able to.
Hi, yes, this is Liz Blackwell Moore. My pronouns are she, her, and I'm the director of Cumberland County Public Health. And I'm in my car and I'll be online in a minute, like with my face. Thank
Great.
you.
Thank you, Liz. And I'm Joe Everett, the CEO at the Opportunity Alliance here in South Portland, a member of the council, and I chair the Grants and Program Committee. So welcome, everyone. So just a couple of housekeeping items since it's been a while since we met. We're returning to the 1 hour. So this meeting, unless there's a lot to talk about, I hope we can keep to an hour. It's 97 degrees outside, and I think people would rather be enjoying our summer day. So we'll keep it to an hour. And then we're going to return to a monthly frequency for an hour like the other all the other committees. So just to get that out of the way. And then we'll start right in with Chastity, Elizabeth, Pat, Grayson regarding just any contract updates that we want to talk about today.
I think there's roughly 10 to 12 that are still going to need to be done. But we have time because those aren't able to even be paid out until October. So we may be reaching out, like we just had to reach out to Liz to get some contacts on some of the prevention stuff. And we may be reaching out for others for contacts and help with some deliverables too, as we're navigating our way through that for the first time. So be patient and hold me accountable, but be patient.
So can we just, for anyone who may be listening in, talk about the prevention, where we're at with that? I know we've talked about in other meetings, but not since we haven't met for a while, but just the timeline and what that's going to look like, Liz or Chastity or Elizabeth or Pat, just to give the world an update, I guess, in the committee.
I can give my sense of the timeline based on what I know. And then if that's helpful, would that be helpful, Chastity?
That's great,
Okay.
yeah.
And then Chastity can correct me if I'm wrong. I mean, my understanding is that Brendan was working on the MOU with Maine CDC. I don't think it's completed yet, unless somebody has other information about that. Okay, so I know he had been working on the MOU with the Maine CDC, but the woman who was the key contact with the substance use prevention program manager, Megan Scott, left for a different job. So now it's like connecting with new folks there to figure it out. So that's like in process, but not completed. And I think the MOU can happen. My sense was that the MOU can happen despite the contract delay because it's not a contract, it's an MOU. I don't know. So I think that one should be able to happen. Of the work around community coalitions, the health resources in action is ready to go. Like they're like, when are we gonna start? And they're now their understanding now was that the contract wouldn't be signed until and ready for them to start in October. And they're ready to go in October, whenever that contract is complete. And their work will be to develop an RFP and then provide TA to any organizations that want to apply for the community coalition work. And so I don't have the exact timeline based on, I think their sense it'll take a couple of months to like develop the RFP and be providing, starting the TA work and then the RFP process. So I think that Mary had been in contact with them about some of what would be on the deliverables for their health resource in action. And they had a pretty detailed proposal that I think can be used pretty easily. But that was my sense anyway. Maybe there's some corrections on that, Chastity and Elizabeth, about whether or not there was some work already started on the contract. But our hope is that would start in October. And then the 2Gen work, I think what we had proposed was that the RFP like sort of dovetail with the RFP that HRIA makes for us, so that we're using that as kind of a template. And so it's essentially on a similar timeline, right? But we didn't build in TA for that because our sense was that there are programs that pre-exist and will either expand or go into new places, and that it's not like exactly like the community coalition work. Like it's more like pre-existing organizations that do this work will be able to apply for that very particular RFP to do 2Gen work. But again, I think the timeline on that then is pretty similar. So I guess if we're like walking it out and thinking HRA has their contract in October, perhaps an RFP is out in the winter. And I don't know if Chastity and Elizabeth, you have any thoughts on that, if that's your kind of assessment as well.
It is. I will say on the CDC MOU, well, first off, even though that we see Grayson here, he's not here at the moment. He's having a fire alarm issue, so we can't ask Grayson for help, who can help in some of these moments. The CDC MOU, it's drafted and Brendan's reviewing it. We do have a new contact. I don't know if it's going to be who we stay in contact with for this, Liz, but it's Lexi Perry is who Megan directed us to. So we'll check in with Brendan tomorrow. We have a weekly check-in with him to see where he is on the MOU, because I think that's the only thing holding up that. Everything else, the timeline sounds right for what I know. I don't know if Elizabeth knows more than I, because I have not dug into any of those things yet, quite honestly.
Yeah, I think that makes sense. To be honest, I also have not been too involved in the prevention work, so I don't have a sense of a different timeline, but
Sorry, I was muted. Go ahead, Todd.
I don't want to jump ahead. I just had a generalized question that's kind of related. I think wearing both hats, just coming from a finance committee meeting last week. Have we, I just can't remember, with regard to the prevention work, has the council finalized what the term of that, of the proposals are gonna request, you know what I mean? In other words, are they gonna be 2-year blocks, 3? I know it was recommended longer, and is the finance, what made me think of it is the finance, part of the discussion that came up at finance was, as we take another look at the budget, the long-term budget, and try to balance things around, just trying to recognize what reoccurring funding was, and quite honestly, what those obligations will be for us. And I couldn't remember whether that's still an issue that needs to be finalized, or whether that's already been taken care of.
Well, my sense of the timelines is that they are longer, but it doesn't mean it's more money. And do you mean like when will they be up for like another round that they might want? So like the CDC grant, we did a 3-year, that was for 3 years, but it doesn't change the amount of money. But yes, it does. It's not in 2 years that they would be saying, hey, that was really great, and we could keep doing this work if you provided this much funding. But that would be in 3 years. And then the community coalition work and the 2Gen work, I think we were trying to do 3-year timelines as well on those. I now can't remember if we did a 4-year on the community coalition work, but either way, it doesn't change the total amount.
Yeah, I don't think that's the total that was the concern.
Okay,
Liz.
got it.
And I don't think
Okay.
it's the length necessarily that's a concern, or it's not necessarily a concern for me. As much as it is, how does that fit in the budget? So if
Totally.
some of the grants, expire after 2 years, folks can reapply, obviously, or whatever the rules may be. Some may go
Right.
longer, and it's just understanding those terms for
Yeah.
each of as it moves forward, will help the finance committee at some point.
Okay, well, we'll make sure we get those to you really clearly. I mean, I know the Maine CDC contract was 3 years. I know that for sure. So the other ones we can see, well, we haven't made them yet, so we can see what they are. And we haven't made those RFPs, so we can decide still. We can change that if we needed to, but I believe we were recommending 3 years on those.
Yeah, 3 years was my understanding also.
Mine too.
On the HRIA, I just went back to look on some of this stuff. We've gotten all of like the administrative stuff from them that we need prior to the contract, so that way everything should be able to be set to be executed for October 1. The only thing that we really needed to change from them is how they bill us, because they wanted to do it per deliverable, and our side we needed an hourly rate. So Grayson worked with them to work that out. So that timeline is good for now. But something you brought up, Todd, in that reminds me that as a whole needs to be figured out, and not just prevention, but all of the stuff we funded. The council really needs to decide what's it going to look like going forward. Are any of these going to be renewed? Are people going to apply? What's that look like? Because we're already getting requests from people asking, like, are we going to be eligible coming up in the fall? And another one, sorry, I'm just throwing this now. This is all other business, but I think it all applies. Decide how we want to handle like carryover funds, and no cost extensions, because those are all questions that are coming in too that we've never made a decision on.
Yeah, they all have to be done. And then as we learned we've known all along, with the budget and the way the funding comes in, there's years that we have to be concerned over, because if we spend at the same rate, we're actually in the minus column versus being breaking even, which is the goal. And so we really seriously have to look at where we are with what we've spent, determine whether those will continue or not. And Chastity's right. The first round of grants we gave, they'll be out shortly. The SSPs, they're on their second year, right?
Now, the SSPs, they're a little over halfway through year 1.
Oh, okay.
But like Recovery Wellness Institute, they've already completed their first year. They're in their second year and
Yep.
are already asking what happens after July next year. And especially where like not all the recovery centers get the state RFP, that's coming up more, and they did not get it.
Yep.
So Pat, what's your thought around talking about no cost extensions and carryover?
So, you know, in the good old days. I'm so old. We used to be able to have carryovers. Um, I think there needs to be a procedure with that because some of it could be very well be legitimate. You know, sometimes you think you're going to have a startup and then the building falls through, or you're thinking on this and this doesn't happen. So there's legitimate reasons for carrying that money over. And so I would like to see, and it doesn't have to be a complicated form. I'd like people to be able to do a carryover if they're staying within the same mission that the
Mhm.
original grant was for, and they have a reason why the funding wasn't spent. Um, and then make a decision per case rather than make a blanket decision saying no carryovers or yes carryovers, that really they have to present their case as to why they're asking.
Yes, I agree with that thinking. And does it make sense then for Chastity and Elizabeth to work on that? I mean, the staff, you guys can, even borrow, like other foundations have those procedures that we could borrow. And I agree with Pat. I don't think it should be deliberated five at a time. It should be case by case.
And you can even do something so we're not caught off guard that, if you think you're going to have a carryover 3 months before your grant ends, you should be applying to carry that over. That way, all of a sudden, we're just getting bombarded all at once and making that decision quickly. If we tell them, think of a time frame. But there are legitimate reasons why funds weren't spent.
Yeah. Does anyone else have thoughts about this topic? Todd, go ahead.
It's a question more than, are there downsides to, I'm not a grant, I don't, I deal with government grants and they're pretty, it's not, they're pretty black and white for us in law enforcement mostly, you know what I mean? Or at least the ones I'm familiar with. So, is there a downside to like a no cost extension other than the administrative work to keep an eye on what's going on? And so I don't really understand what that means.
So I'm going to let Liz and then Maggie talk because they may address that question, Todd, from their experience. So go ahead, Liz, and then Maggie.
I think it's a great question, Todd, and I think my sense is that the downside is that somebody had a hard time spending the money, and we want to know what that is. Like, is there a particular barrier? Are they not able to spend the money? Did the project not work the way it is? Like, I think a blanket, like, go ahead, you can have a no cost extension, means that we wouldn't have like a checkpoint to see like what happened that made that hard. But I think most of the time a no cost extension is like, I mean, especially there's like startup time you thought was going to be quicker that took longer, and that most of the time they seem super legit. I was thinking that if there's a way in which you could have a deadline by which you say, we request all no cost extensions by such and such a date, like you're saying, Pat, so it doesn't all happen at once. Like, and then you review those and you write a summary of why people want a no cost extension, how much money it is, and we vote on them like as a whole. And so we don't have to go like, we're not expecting the council to go through and determine each one, but like maybe there's a way staff could recommend like yes for whichever ones, and then give a recommendation why maybe this one we should do some more research on or ask for more information or something, so that and if there's time for that, that feels like that's a reasonable thing, so that we don't, all the council members don't get into the nitty gritty of all of them. Not that I don't want to, or get like a group together. Maybe it's Program and Grants does it like we do it, and we look through all of them so that it's a subset that then makes a recommendation, would be what I'm thinking right this minute.
Thanks. Liz has echoed a lot of, or stated a lot of what I agree with. I think Chastity, my thought would be on your end, like with a sense of how hard it is to issue these administratively, like basically deciding, are we going to just do 3 or 6 month NCEs? And if it's so much admin, then let's just do a 6-month NCE. There's very little downside on our side other than they probably won't be able to make it through 6 months. They'll spend down in the first 4 or something like that. But maybe that can, within those two parameters and figuring out what works. And I agree. I think if the council could vote on the framework for what qualifies for an NCE, and it doesn't have to be super complicated. It could be for reasons X, Y, and Z. And then staff or the vendor has just like a checklist where they mark off whether they fulfilled those reasons. Just because the frequency of our meetings won't allow for the timeliness of a response that they likely need. Usually when you're submitting an NCE, you need a turnaround decision in the same month to know whether you're going to be laying staff off or able to continue programming. And so it will be, I think, helpful if that we're able to find a way to delegate that decision in a way that the council doesn't have to meet to vote on each.
Thank you, Maggie and Liz. And I just know from our experience at TOA, like it's a lot of work on the funder. Like and there you have a lot, we request them fairly regularly, and there's a pretty rigid timeline that goes with the extension. And as Maggie said, sometimes you spend it in 4 months and 6. So I think Chastity and Elizabeth, if you guys can take it and like run with that and then bring information back to us, that would be great.
We can do
Um,
that. Thank you.
So just because time's ticking quickly, Chastity, is there any other grants from the last grant round? Like what's outstanding? You can just back of the napkin. Is there what contracts are outstanding?
Recovery High School, we just met with them. So that's being drafted. Elizabeth, you're going to be able to rattle them faster than I. They're York County, Somerset County, the jails. Sorry, I'm blanking.
So a
Give me
few
a sec.
pretty hefty ones.
Yeah, and some of them too, we can't pull from other grants to like help shape it in the deliverables and stuff because it doesn't exist. So they're taking a little longer.
And then we do have a couple of treatment contracts. There's a day one contract. And then we do have a couple that were finished or just about finished, but either didn't quite make that last allotment deadline or the provider asked for that money in the fall. But we were able to have those contracts in a good place for now. So we do have quite a few that we have quite a few actually that are with providers right now that they've been reviewing actually for a couple months. Like Kennebec Behavioral Health has two that they've been reviewing. York County government actually asked for their money at a later time. And so there are more than it looks like in terms of work to be done, just because those are in a better place with drafting and review for the providers. So we have quite a few that will need to be moved through for financial. So that will be a lot of work for Summer when she comes back. But for drafting, we don't have too many. So
That's great. Just a question that a couple people have asked about kind of our process in the community. And I remember, I forget do people get sort of an allocation letter first? Like when someone gets awarded, what does that look like? I forget. I know Mary's explained it, but just.
So I don't necessarily know that it has been a blanket or that there's the policy as far as allocation letters. I know with the SSPs, originally they didn't, but it was requested. So for planning for budgets, I in this big bunch, do you know if people all got them, Elizabeth or Pat?
I believe so. I think for finance, we've tried, and this may not be exactly what you're asking, but been trying to include more information in those contracts, especially on the first page, about when the payments are due, the breakdown on the first year. And then we do get from finance, I think, we get a letter, I think it is the procurement letter goes to them, and then they do get that fully signed contract. But when they review the contract, we do try to give them that information about when both those payments will be due, and if they're not even splits or, you know, the same both years, what that'll look like, just so that they have that information. Because, you know, for some people it's front loaded, and just so they have that, they know that information as early as possible. But I think Mary tried to have those conversations with people. I think that was something we didn't try to just decide. So, yeah.
So what are people's thoughts on, you know, I think many of us are used to getting an allocation letter, and but do people have thoughts about it? Not to, and A, that's my first question. And B, can staff just do that, Pat? Like, does that need to go through us, or like, can Chastity go, well, I'm going to develop some process? So what are your thoughts, Pat?
So my thought is that an allocation letter probably would, because if you're a large agency and getting an audit, they're going to ask you for that allocation letter. Auditors are going to say it. So I think it's probably best practice at this point that we have a standard allocation letter that be. And again, that the staff would be responsible once the council has made the determination of who gets what and how much, then a simple standard letter can go out with dates about when, again, we need to get better. It's one of those hindsight things about dates when we'll hear when your contract, you know, done. But I think a standardized letter sent out by the executive director once those decisions are made only makes sense. And again, most of the agencies that have to have full audits, which a lot of them do, the auditor is going to be looking for an allocation letter. So
Yeah.
we should be prepared to do it.
Great. So moving along to reporting, is there anything, Chastity, Pat, Elizabeth, we want to talk about in terms of reporting at today's meeting?
So I don't know about Chastity. I only have one quick request, that this committee look at funding request outside of the grant process and a policy and procedures in regards to that. I think as some of the stuff is coming in from the feds, we're going to find that we have more and more requests. And I think if we're ahead of the game, if we have a policy in regards to, I would call it non-grant cycle requests or emergency requests. I don't know how you want to put it, but I think it would be in our best interest to have a procedure. So when Chastity gets that call, or somebody gets that call saying, oh my God, I just lost my funding. Does the Recovery Council have any money? Well, here's the process in which to do it. And so we are able to follow that. So I think that would come under this committee. And I would suggest, we started it at one point. I mean, we can start with that, but I think we need to move forward with that.
Go ahead, Todd.
I'm glad to hear Pat say that. I think that's important. Can we, as part of that discussion, can we talk about, I know it's been mentioned in the past, but is there a way we could do, or that process could include a way to handle smaller requests, like something under $10,000 or whatever? I'm just using that as a discussion point. Just a thought as part of that discussion.
Yeah, I think that's a good point.
Go ahead, Tess.
Thanks, Joe. Yeah, Pat, I agree completely. That's been on my mind a lot, and just hearing out in the community of, you know, some recovery centers closing their doors. I think we're gonna start hearing from a lot more organizations. And I'm no longer a member of the finance committee, but I'm wondering if at the same time we can also be looking at our budgeting to see what amount of money we would have available for whatever this ends up looking at, whether it's discretionary, emergency, because I think that's important too, to also recognizing we're probably going to need to respond to emergency needs, but also looking ahead in terms of the next 17 years, making sure we still have some sustainability.
Finance is looking into that. We're trying to figure out what that dollar amount is that we haven't allocated or promised, what's left.
So I know in prior meetings, sort of the one-offs or emergencies, there's been thoughts about kind of what you said, Pat, the process not like a fair process, I guess. So I guess I just raised that because there's been conversations about that. So Chastity, more work for you in your first 5 days of work. Any, oh, go ahead,
Um,
Maggie.
One of the things I worry about, well, before worrying, I'm so excited about getting this process set up because I do think there's so much risk right now, and we are so fortunate to be members of the council and supporting the delivery of these funds that if anything, like this is a place where the funds can respond where other resources just aren't gonna be able to respond that fast. And so I'm really excited about setting something up that allows us to do that. I, similar to what Tess said, I'm nervous too, that once we open those gates, it will distract from some of those other longer term initiatives. And that in some cases, in the range of what we can offer against the scale of what challenges people might be facing, it may not be something that we truly can influence at the end of the day. And so I worry about circumstances where we have really critical services that are going to be going offline in areas where there is no other service. It makes sense for us to step in and where we can in those places, but how do we build into this some guardrails to say we can't step in for more than X number of years or whatever that is? Because if we become the only backbone in the long run, that then is similarly cutting away from the investment in the other ones that can run longer. So I think it's not an easy task, and looking forward to seeing what we can come up with that's the best of possibilities, and appreciate the thought that's going into that.
Yeah, really good points. And I think that to your point, Maggie, that the people are gonna like the OMB, the Office of Management and Budget, is impounding money. And we're not talking about 25 grand. Like there are big impoundments that agencies across the US have suspended operations temporarily, but they're just things that we cannot take on. Like they're big numbers, and TOA has one that's impounded and it's a big number. So, it's so devastating, but we won't be able to fill. And they're also like, with an impoundment, you don't know when it's going to end, and you don't ever know if you're going to get your back pay or not. And it's sort of new to many of us, but there are going to be some really devastating situations floated our way.
There's some things that we can be a life jacket for, and others we just we won't be able to, which is incredibly sad for me, but it's the truth. And that's those Maggie was saying, I think those are those hard decisions that have to be made. Because some agencies are losing such critical parts of their budget that we just can't,
Mhm.
there's no, because we can't do it year after year after year. And so we have to seriously look at it, but it scares me. It scares me with the falling off of Medicaid dollars, Maine Care
Mhm.
dollars, and how that's going to affect so many of our programs and our clients. It's scary times.
That's a huge one, Pat. Medicaid changes, eligibility changes. Okay, just to keep us going. So I think, Chastity, anything you want to add on this section? Are we good on reporting all that? So we want to talk a little bit about community needs assessments that exist. So we had a good conversation at the governance committee about community needs assessment planning, and I think that sort of belongs probably over there, that the council in there. And I think I would throw out for this group that our charge is to sort of like look at what's out there, community needs assessments that are happening, and kind of like sift through those and learn from what we're seeing in those assessments. But does that sound like a good role for us? I would open that to and then we can talk. Chastity shared some of the current ones, and we can talk about those. But does that sound like a good process in terms of our role and understanding community needs? So Chastity, do you want to talk a little bit about the three that you sent out, and I can talk a little bit more in depth about the shared community health needs assessment? And I think you sent out three different ones. Not that you know the detail, but any just
I, I did send three, but I'm gonna actually punt this and say Tass can talk about the MIRAP one. MIRAP one's a MIRAP listening session. I'm gonna give Pat Dr. Johnson's, and then you can take the big one.
Okay, perfect. Tess, you're up.
Woohoo, okay, give me just one. Oh wait, we can't post anything in the chat, right? You guys have copies. Um, so I'll just give a quick summary. We had 33 listening sessions, all 16 counties. We heard from 674 people. We hosted them at recovery community centers, coalitions having to do with substance use. We tried to do rural, virtual. We just wanted to hear from as many community members as possible, which included folks who use drugs, people in recovery, their family members, allies, as well as service providers. As a grassroots organization, we rely heavily on listening to folks that are experiencing challenges. So if you go through the listening session, we have short summaries of every single one, trying to highlight the biggest needs that community members identified. We didn't ask the question, what do you want funded? It was more, what are your needs? What are your barriers? What are your challenges? And that really just kind of comes out in what we put in the summaries. You'll see our 132nd legislative policy platform. So that's pretty much a summary of everything that we heard for what barriers there are. And we had a policy proposal survey and policy recommendations, so things that we've seen need to be fixed with policy solutions, but also again, shed some light on what communities wish that they had in terms of healing from the opioid crisis. So I am happy to answer any questions, whether it's right now or at a later date. You can shoot me an email and I'll do my best to help.
Okay, well, we'll move along to you, Pat.
So Dr. Johnson's is probably the opposite of Tess's. Not really opposite, but it's from a different view. So she really was hired, if you remember right, you can all see the report, within the first year, a little bit over into our work. And so her job was really to research the data, not necessarily that of public comment. Hers was really a data search to look at where there may be some hot spots about, unfortunately, people dying of overdoses, and a little bit about treatment gaps and things she saw through data and evidence. And so again, it's, the perfect world is when you combine what Dr. Johnson had for the data and what people were looking at, particularly those with lived experience were seeing, and where do they connect, and how, again, and how does that best fit the needs of community using both data and both lived experience. So I don't think there's much to explain about Dr. Johnson's, other than it really was a data search of Maine data, and grouping it together from several sources that she found within the state, and put it together for the council. She has a couple of recommendations, or I don't know if they're called recommendations, but again, looking at where we were data-wise with the opiate crisis.
Any questions from the group about Kim's work? So, and just lastly, the Maine Shared Community Health Needs Assessment, also known as the China. This year was the first time, so it's been going on for 15 to 20 years, done every 3 years by the many large hospital systems. This year they added the 10 community action agencies so we could get a picture of health and also the social determinants of health. Um, Great process. I think I sent out the link to the group where Chastity did. So the cool thing is there's the statewide document and then there's all the county documents. So there's some variation by county. Um, but there's just, I think, really useful information in the report that we could look at. So just in terms of some of the, cross-cutting themes, obviously housing, transportation, poverty, and helping people out of poverty, provider availability, substance use like came up at every conversation in every county. The intersection with mental health came up a lot. ACEs, adverse childhood experiences, came up a lot and the nutrition and food access. But one of the things that they really highlighted was sort of just overall access and the fact that there's like one psychiatrist for 12,000, every 12,000 Mainers. So the shortage of med management psychiatric services is enormous. Um, so I was gonna try to pull out sort of the key points of the China, but then I thought that's not my place. I think I would recommend that as we're talking through these, that we consider inviting someone. So in the Maine China, Heather Drake is the program manager. She's been at it a long time, and I think if we really wanted to get the nuts and bolts, we should have Heather join a meeting for a few minutes just to go over it. And she probably has more summary documents that extract some of the key information. One of the things about the China that I think is fascinating, kind of along same line what Kim did, is there's so much data and it's very relevant right now. It's a lot of really useful data. It's a really useful document for TOA, and we have our own for Southern Cumberland County and York counties. But just I think a really good document, and or good process. Uh, a lot of data gathering. There's key inform interviews. They did focus groups all over the state. So a lot of hearing from people, in local communities, a real focus on health disparities, equity. So a really great report. So I think that having folks, we could get more information if it's the will of the group, but I don't mind reaching out to Heather also to see if there's more because it's hard for one of us to read 90 pages. And she like lived and breathed it. But go ahead, Liz.
Yeah, I guess I think I guess one of the sort of challenges I see is that there right now is mountains of data. And I think just even thinking about those three pieces, like the three that we just mentioned, there's so much information to be taken from that. And I guess I'm wondering, like, it feels like we need a little bit of like what's our goal, our end goal, and then back into how do we understand and take in the data? Because there's so much that if we start like data first and just like have people come and talk about it, I feel like we could end up a little bit like wallowing in the like there's so much. So it's more like what do we want out of this? Like, do we want to know what's still missing, what hasn't been done, or do we want to know like where is there like right in this moment, which part of the problem we should work on? I feel like Kim's was very overdose focused, which isn't the only outcome from the opioid epidemic. There's other ones. But is that the road we want to take? Or do we want to like, I sort of feel like we need a little bit of a like, what's the funnel we're going to put all this data through? Like what's our lens by which we want information on the back end? And like, do we want to include information about what are counties and municipalities spending money on? What did the AGs spend money on? And where are we with like, what still needs? Or do we really want to have a big picture? Like, what's the big picture problem still of like the big picture issues that still exist? Which then you could look at kind of all the data and have somebody walk us through that. Am I making sense? Am I being just like,
Yeah, that's really good, Liz.
okay,
And like really hard too.
I know.
But really like it's at the heart of the matter.
Well, I mean, I did a county health improvement plan a couple years ago, and we decided not to do more data gathering because there was so much data that we decided to take the data and then go ask people about it. Like, here are the key things. What do you think is still missing? What do you think? And did like sort of listening sessions with different groups of people within the county. And it was a broader brush, of course. But I mean, that's another option is we like have somebody, hire somebody to look at the data and then make sense of it. Like what's still missing,
Mhm.
or pair that with the listening session that we want to do in December, where you're like, people are reacting and responding to something like, yeah, that's because the data doesn't necessarily always shine a light on the strategies that are needed. It will
Mhm.
shine a light on the problem, but you need others to shine a light on the strategies sometimes that need to happen at the local level. Because you'll look at that data and be like, yeah, it's poverty. Okay, but what do we do about poverty? Like what things are happening now related to poverty and what things could we be doing? Or this intersection between ACEs, suicides, and substance use disorder. Like there's a national movement on that.
Yeah.
Like what they have some pretty clear strategies on a national level of what we could be doing to do that work. Like instead of like we know we know those problems exist here, maybe looking at the data of where are they worse in the state and then looking at what are the strategies that we could be deploy to those places.
Really good points. Go ahead, Pat.
So 100% agree with Liz. And sort of in my head, my goal that I'm thinking is that in a year we're going to be starting this grant process again. And so where are we going to focus, and where are those gaps? What are we going to do? I mean, it took us a year to get the other grant out. It may not take us a year, but technically in another year, we will be looking at how we're going to put out these goals. And I would like to be able to say that we researched the data and we saw where the gaps are and look at what has the biggest impact on our community in regards to the opiate crisis. And again, I think Liz is right. There's a lot of data out there. I'm not sure, again, but where do you invest? Where's the best place to invest our money? And are there holes in the state that aren't getting any services that we need to be able to concentrate on? Because if the data is high that there's an extensive substance use disorders are affecting this community and there's no services, how can the council take their funding and help that community?
Great points. Maggie.
I wonder if there's a way, I agree about the data, and apologies, I had to step in and out and showed up late, family emergency day. But one of the things that I struggle with as a new member to the MRC, also though, because of my role in Portland, where I'm seeing a lot of what's going on in Portland specific, is that sense of geographic variation and where those deserts are. And I think a needs assessment that looked, because I think we likely will, I'm hesitant to believe that we'll be able to say that there's a certain part of the continuum of care that needs more than another, because I think there's holes across everything that could be offered here. And so, and depending on your stakeholder group, everyone prioritizes one element more than another. Maybe it's prevention, or maybe it's treatment, or maybe it's recovery. And so I think we have a lot of landscape data on what needs to happen in those spaces. It will be really hard to prioritize within that. But where we don't have necessarily, and maybe this is just me and my awareness is limited, but is some of that geographic data around what particular elements are available in what parts of the state, at what range. And I think that could even be really helpful to us as we are pursuing that structure for kind of emergency grant funds, right? So if we know that there's a particular risk in this state with a real hole here, and we have an emergency grant fund, may give that more weight than we would for another area of the state. And I think it's also cart and horse. You know, we see a lot of people come in and services centered around the greater Portland area, in part because that people can't get them out there. And so making sure some of that's available in rural areas. I think we could also apply some nuance to that. I was recently speaking with a provider who said they get frustrated with that rural urban classification because they're having to spend money on transport for people from Lewiston and Sanford to be able to get to clinical services and addiction medicine services in Portland because they're not available there. So I think somebody who could give some of that nuanced analysis of the geography of the state could give us some help in our decisions in the future around weighting while fulfilling some of the kind of needs that we need to meet to get a needs assessment. And I'm sorry I stepped out, last minute thing. I do have an assessment that was done primarily with an overdose angle. So it's looking largely at harm reduction, overdose prevention actions. But that's for Cumberland County, and I can share that with this group.
That's great, Maggie. I was going to ask about that one. Yeah. So it seems like there's a little bit of prep work. Should we like next month, like kind of dive a little bit deeper into like I like when you said nuances, Maggie. I think there's so much data too, I think getting to the information, but what do we see as the next step in terms of understanding the data? Um, And like Chastity, do you feel like you have capacity to do much? And I think I've asked you this already in another meeting at the governance, but it's a lot of work synthesizing and going through data and lining things up and understanding it. But what do you think?
I think yes and no. And I hate being like in that gray area, but as I'm still figuring it out, I don't know. Like, not for the next meeting. Yes, I obviously could. I don't know how much I'd get through that for the next meeting as I'm learning everything else.
Well, and
So
also, can we pause? Should we wait and not take this up for a while? Since whatever, what's the best use of our time? And do we think that we need to have an outside person help lead this sort of review of information?
So here's my thought at the moment. If you wanted that done within the next 6 months, my opinion is you need to hire outside to do it.
Mm-hmm.
Chastity has her hands full with council business, with the new contract that hopefully with the RFP, with the grant reporting and all of that. And once Chastity gets past, I think, that first 6 months, you don't know. At that point, she may say, I got time to do that. But right now, if you want it done within the last 6 months, I'd be a little bit concerned that we're overloading Chastity with all the stuff that she has to do for council business and grant work and the prevention work and the school project hopefully coming up that we're going to start working on some of that and just coordinating in general. That's just my thought.
Good points. Liz.
Yeah, I mean, I think this is a really great succinct project to hire out for because it's like it's a discrete project that someone doesn't have to know details about the council, like, to really do the work. So I would highly recommend, and having done assessments and paid people to do assessments and done them in conjunction, like it's something where we could do some prep work as a program and grants committee with an outside consultant to help get them started, and then they could come back and back and forth, and we could support their work to narrow or clarify exactly the work. I highly recommend we farm it out.
Yes. So that will require us sort of creating an RFP. It sounds a lot, would that be the will of the committee? And again, it doesn't have to be tomorrow, but what?
Yeah. And I just need to clarify something. I think I'd be having the same conversation. I just need to say it because I think Chastity's quite capable of things. I'd be having the same feeling if Mary was still here. I think that right now there's a lot of work, and I don't think it's just because Chastity's new or she's not capable of it. I just need to say, I think we have the funds to do it. And I think at this point in juncture where the council is with staff, it needs to be either RFP'd or we send requests out to some people we know that do the work and have them send proposals in.
Yeah, absolutely. This has nothing to do with who's in the ED role or the staff. It's that the staff already have a lot on their plate.
Yeah.
And this is super easy. Like this is like, there's like a lot of organizations who do this. It's not easy work, but it's work that is done by lots of organizations that could take it on.
It's
Yes.
what they do. So it's easy for them. Yeah. It's their expertise.
Okay. Well, let's think about that. Any other business for today's meeting? It is 4 o'clock. So in terms of the next meeting and this conversation, do we think we need to meet in August? Do we have like, we're sort of finishing up grants, but what do you think, Chastity, about sort of the need for this group to meet again in August, or should we meet in September and then resume our cadence in terms of timing and all the things that we want to accomplish? Sorry to keep putting you on the spot on your
No,
first month.
you're okay. I think if you want to get this process started sooner rather than later, then you're going to want to meet in August to iron out the details of what that looks like. Otherwise, it doesn't get figured out till the end of September, and then who knows before we get someone brought on to start it.
Okay,
And you're okay to put me on the spot.
No, so I think then our meeting will be the next meeting. Let me look at the calendar. So it looks like it would be August 26th. Does that work for folks?
I'm
And
not
we'll
sure.
work up in Chastity and Pat, like I can send, like I can sort of try to get the agenda shaped up because I know Grayson's going to need that ASAP. But it's just sort of like it's a lot. It's a lot to dig into. So I think anything we can do to prime the pump, to have the conversation and ideas about, people, groups that do the work.
So all I can say is the 26th is my youngest grandson's 21st birthday. I may not make it or not. He hasn't finalized his plans, so I don't know. But that's fine.
Yeah, good for him.
I'm just one person, but my baby turns 21 on that day.
Well, we'll send it out and then we'll see what people's availability is. But
why do I have Chastity? Why do I have the 19th and the 26th blocked off?
For program and grants or in
Yeah.
general?
And for program and grants, I have the 19th blocked off and the 26th.
I'm guessing from the old recurring where we used to go twice a month.
Okay.
And then when there was a pause, it was decided to just change to the end of the month.
Okay.
Once a month.
Thank you.
And if people still have the old ones and it's from Zoom, you have to delete them yourself. When we delete them, it doesn't do it for everybody for some reason.
okay. Well, I think that's a wrap. We will get the invitation and the agenda out for the next meeting in August. Enjoy the beautiful weather and thanks everyone for.
Thank you, everyone. Have a good
Bye.
day. Thank
Bye.
you.
Thanks.